Hi, I am Emanuele Brianti. I'm a full professor of veterinary parasitology at the Department of Veterinary Science, University of Messina. I'm based in Sicily, in Italy. We are observing an expanding of vector-borne diseases, especially dirofilariosis, canine dirofilariosis in Europe, and canine leishmaniasis are really enlarging their area or occurrence, and this is because there are several drivers for this, and of course vectors are expanding as well. We have also new vectors, alien vector species that act as competent vectors for instance, for Dirofilaria mitis. We have Aedes albopictus, the tiger mosquito that invaded all Europe, is a perfect component and is a perfect example of vectors expansion and colonization of the area. And we have also the expansion of area and activity of sandflies that act as vectors for canine leishmaniasis. Now we have a large variety of new and very effective and safe products. So currently we have in our hands a large number of very effective products that allow us to prevent and in some cases also to treat vector-borne diseases. But of course we have to increase the use of prevention. So now we have the materials in our hands and we have to use in a proper way and better. Protection is fundamental of preventive medicine. Prevention is very important because in most of the cases it's easier, it's effective, it's safe. So of course we want to protect our pets instead of treat them, because when you treat a pet it's a kind of failure, and treatment in many cases is more complicated, is dangerous, is also much more expensive compared to prevention. So this is why we want to increase prevention instead of treatment. And also this is important for pets, for their health, for their welfare, but it's also important for humans because for many vector-borne diseases, pets act as a reservoir also for human infection. So if we manage well vector-borne disease in pets, we will observe a decrease also of human cases. That is for sure. We will observe an increase of infection, an increase of sick and infected animals, and we will observe also simultaneously an increase of human cases. Canine dirofilariosis and canine leishmaniasis are the most and the widely spread vector-borne diseases in Europe, and these diseases impact the health of the animals, are in some cases are life-threatening, in some other cases they impact on their welfare, on their health, on their expectation of life, and they impact also in the relationship with their owners, so they really impact hardly on their health and their welfare. Especially at the beginning of the disease, if the parasite burden is not such high, you may observe very few symptoms at the beginning because parasites are smart and because they want to stay hidden as much as possible in the time. At the beginning, animals do not show symptoms. They are apparently healthy. And this is a perfect example how parasite also can maintain and spread into an area, because if you think an animal without signs, probably the owners does not bring for a pet control, and they can maintain and can spread hidden in those animals. But after a couple of months or years, they appear in their impact on the health of the animals. So you may observe also severe clinical signs, such as, for instance, for Dirofilaria, coughing, dyspnea, or syncopes, or for canine leishmaniasis, renal failure, and a variety of dermatological signs. I want to tell you a story, and in my opinion is a perfect example on how this vector-borne disease, these vectors, are spreading through Europe. Well, again, Dirofilaria mitis is a nice example, is the causative agent of canine filariosis, and We thought in the past decades that this infection was occurring only in the northern region of our country, in Italy. But we received in our lab some blood samples from a very tiny island in the middle of the Mediterranean Sea. The name of this island is Linosa. So it's a very tiny island between Sicily and Tunisia, so very in the south. And we received these blood samples, and 7 out of 8 blood samples were microfilariamic. So they were the microfilaria of Dirofilaria mitis. And it was, we were shocked, and we went there. At that time, we were in the first COVID pandemic. So we went there in June 2020, and we sampled all the dogs in the islands, and we got 60% of infection in that small island. 60% in that island. It's an incredible high percentage. Never observed even in those historical endemic areas. Of course, because of the epidemiological peculiarity of the islands. But also Icelanders were positive. They were seropositive. So this is a good example of how a vector-borne disease of dog can also impact human health. And we started an eradication program, so we treated all the infected dogs in the islands, and we prevented those that were negative. And we eradicate the disease in just one transmission season. So, 2 take-home messages. Disease and vector-borne disease are spreading, but also we have in our hands the instruments to control, to prevent, and if we work well and we manage well this vector-borne disease, we can keep under control.